Message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see? We've made vaccinations free, safe, and convenient. The vaccine has FDA approval. Over 200 million Americans have gotten at least one shot. We've been patient, but our patience is wearing thin, and your refusal has cost all of us. So please do the right thing.
So his patience is wearing thin, and look, admittedly, I think Biden has about as much patience as anyone. But what he's saying there is, it is free, it's accessible, it's FDA approved. And remember when we thought, I wonder if that's going to make a difference? Doesn't really seem like it did, at least rhetorically. But now, in addition to the rhetoric, they also we have some changes coming. So let's see, the Department of Labor's Occupational Safety and Health Administration is developing a rule requiring all employers with at least 100 employees to make sure their workforce is fully vaccinated, or require unvaccinated workers to get a negative test at least once a week. OSHA will issue an emergency temporary standard to introduce the vaccine requirement, and companies that fail to comply could face fines of $14,000 per violation. So this is beyond. Earlier this week, we talked about the executive branch vaccine mandates. They are working on a sort of mostly vaccine mandate for a lot of workers. Something like 100 million Americans work for companies that would be affected by this rule. So here's what we're gonna do. We're gonna talk about this. Later on, we're gonna be talking about the response of the right after our first break. But I do want to also throw out, Brett, that this is being talked about by both the people that like it and the people that hate it as a vaccine mandate. But it does allow you to just keep getting tested instead. Like, it literally does not require you to get the vaccine. And I feel like that is not even 1% of the conversation.
So federal workers are mandated to get the vaccine, and there is no option for testing. But in terms of being the broader implication, I think parts of it are just dumb. They're like, what do you mean by 100 employees? What if all 100 employees work remotely? Like, you need me, I haven't left my house. As John calls me, a recluse when he thinks I'm not watching on Wednesdays.
You call yourself a recluse.
But the truth is, I haven't left my house in like, professional recluse. So I haven't left my house in months, really, to do anything except go to the supermarket, and I don't interact with anyone who works here except for my wife, person to person, and we are taking a lot of precautions. And so I think if there's a caveat that if you have a workplace of 100 people who are in close contact, that might come out later. That makes sense that you need to do that kind of thing. And those kinds of thresholds in terms of size of business do take into account things that I think do find common ground with a lot of people, regardless of what side of the aisle you're on. In that I'm upset at large corporations who take advantage of these loopholes when they don't really care about their employees, and small companies are going to face a disproportionate burden in terms of cost of their people going out and getting tested. But we are facing a global pandemic that has killed hundreds and millions of people. And some people, I wish I could talk to them in terms of them taking it seriously, but they're taking it very seriously when it comes to politics, not when it comes to death toll.
Yeah.
And that's very frustrating.
That's consistent, at least. It hasn't really seemed to matter to these people from the beginning. And look, we'll be diving into how people are talking about this in a little bit. But I want to give you a little bit more details. President Biden, referring to what we were just talking about, says the bottom line: we're going to protect vaccinated workers from unvaccinated coworkers, because it's we're 1,500 deaths per day. Again, how many waves of 1,500 plus deaths per day do we need to go through? He also announced vaccination requirements for healthcare providers that accept Medicare and Medicaid, for all federal employees and contractors, and for the staffs of Head Start programs, Department of Defense schools, and Bureau of Indian Education operated schools. They'd previously talked about military mandatory vaccination, so it is starting to go broader. One part that NYC Southpaw on Twitter acknowledged, that again is weirdly not much of a part of this conversation, is this component of it. To continue efforts to ensure that no worker loses $1 of pay because they get vaccinated, OSHA is developing a rule that will require employers with more than 100 employees to provide paid time off for the time it takes for workers to get vaccinated or to recover if they're under the weather post-vaccination. It's weird that the official thing has the expression under the weather. But anyway, that we know, look, first of all, it makes sense. A lot of people getting vaccinated and possibly suffering at least mild consequences for a day or two might need some paid time off. So I'm glad that they're actually thinking about that. But we also know that when you poll people for a variety of different reasons that they might be hesitant to get the vaccine, a fear of losing money, like pay, is one of the more common parts of that. So I'm glad that that's a component of it here as well.
Yeah. And as Fat Guy Named Tiny points out, yeah, it's still not a mandate. You can choose vaccine or weekly testing.
Yeah,
you can do that.
It is. It's kind of a mandate. It's a soft mandate. Or
well, it's not a I'm inject. It's not. It's not a mandate. Like, what is the what is your situation? Like, what is your argument that you don't want to inject yourself with, as people have put it, and I'll show you later in the show, the magic potion?
No.
Okay, if you're not injecting yourself with the magic potion, then I got to make sure you don't have the thing that can get someone sick that we're all concerned about, because of course we are. There's so many people who are like, this is a fake pandemic, but it is killing 1,500 people in America a day. So like, I have to disagree with you. I've talked to people who are talking to their like unions about what the hell to do inside the union when it comes to like vaccine and pandemic deniers, people who won't take the vaccine. What do they do? Because the union's got to pay for your legal defense if you decide not to take the vaccine. So the unions are trying to figure out exactly how to handle this. And they're probably going to come down on, well, we're going to make you pay a higher premium for your health care if you expose yourself to these illnesses in a way that is more risky and more potentially financially burdensome than other things. And it just gets, from one disastrous American phenomenon into another, into like this weird healthcare system that they're going to complain about, but like you're championing it, so you're gonna have to pay the consequences of it. And I don't see any other practical result for it, given the constitutional guarantees that we're all provided with, that people are, accusing others of taking advantage of government policies in terms of welfare, but they're taking stupid fake loopholes to pretend that they have rights against vaccines.
Exactly. So that, and again, like we have to continually lay out what the stakes are so that they have to like get a demonstrated safe, free thing that could save their life and other people's.
Yeah.
But yeah, and you're right. The fact that they can just get tested instead, when you hear the way, and we'll get to it a little bit later, the way they talk about this, when you bear in mind that they can just get tested anyway, the reaction is even more insane than it seems at first glance. But by the way, in terms of that testing, Biden announced that he would be using the Defense Production Act to increase the production of rapid testing kits and would work with retailers, including Amazon and Walmart, to expand their availability. And he said the Transportation Security Administration would now double fines on passengers who refuse to wear masks. So they're even trying to make it easier to get the tests necessary for you to comply with the non-mandate, if that's what you want.
And isn't that what you should know if you're sick, so you can go take your horse pills?
Exactly. Like, how do you know when to begin rubbing the ivermectin into your armpit? Like, right. And the test will help you.
And and this way you'll know that you're sick, and you'll and again, I just hate when everybody says like ivermectin. People are mad at me because I'm taking horse tranquilizers and it's for people or horse dewormers. It's for people. I'm mad at the people who are going and taking the literal horse doses. Morons.
Well, I'm mad at the people that are making the conversation around COVID about that rather than just encouraging people to get vaccinated. That's
right, and they still get to complain. Like, you guys still get to complain. So I don't know what you're mad about. And please just raise your right hand and make a signal to me if you're just being crappy. And I can live with that. But you're gonna go get the vaccine or take a test, and you're gonna protect your fellow Americans, just like George Washington wanted everybody to do when he did a vaccine mandate.
Exactly. Oh no, we're gonna get to some of the people that used to be in favor of vaccine mandates that are not. I also wanted to quickly let you know though, locally here for LA, the Los Angeles Unified School District announced yesterday that it would require all eligible students to be fully vaccinated against COVID-19 by early next year. Under the policy, students 12 years and older will need to be fully vaccinated against the disease by January 10th. And so, that's beginning to spread as well. I should also give you a little bit of good news, at least. So I've been watching the COVID numbers, and for the first time that I've seen, the 14-day change in the daily cases is actually down 5%. It's still a crazy high number, but it has started to go down. The hospitalization rate is slowly climbing, and the deaths are still climbing. It is going to be lagged, but not as much as they were a week or so ago. But again, bear in mind, we have soared past 650,000 COVID deaths in the United States alone. So we might be starting to turn a corner on this particular wave, but there's still gonna be a lot of people in the hospital the next month. A lot of deaths are now sort of baked into the situation we find ourselves in, so bear that in mind as well.
For more political news, breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.